Hi, my name is Mary Brunkhart, and I'm a school and career counselor at Innovative Hematology. Today, I am going to discuss the difference between a 504 and an individual education plan, how to request one from your school, and what accommodations and diploma tracks are offered. So what is the difference between a 504 or an individual education plan? Both are plans put in place for your patient to receive special accommodations related towards their diagnosis, need it be in the school setting or while they are away dealing with a crisis or a bleed. These plans do help our students succeed in school and participate in classroom environments, acting just as any other student with just some remediation or differentiation to help that student feel taken care of or provided for. The table below that you're looking at will tell some of the bigger differences when comparing the two plans, but if your student currently already has an individual education plan, adding the bleeding diagnosis or the clotting diagnosis is recommended. If you do not currently have an IEP, but feel that you would be better prepared with a 504, or you don't fall under the 13 disabilities that would get you an IEP, a 504 statement, just like an IEP, can be requested through your school. It is a free service. It's federally funded through the Civil Rights Protection of People with Disability and Discrimination, and your school would develop a plan with you and a team along with the parents, and that will then follow your patient past high school into any post-high school education that they will be trying to achieve. The individual education plan, you do have additional resources by district with representatives that can represent you at all meetings that is free of charge outside of the school and can offer a more well-rounded assistance than what Innovative Hematology can offer, since they can treat all diagnoses where we can only treat towards the bleeding disorder and our assistance in those meetings. Now, it is harder to qualify for an IEP, but if you don't, then typically a 504 will then be offered. Please look at the available resources online or through Innovative Hematology and contact your counselors for help. Accommodations to consider for students with any type of bleeding or clotting disorder would include unrestricted passes to the nurse. I feel this is going to be one we need to highlight very specifically and upfront at any meeting. The diagnosis needs to, one, be taken serious by all staff members and teachers interacting with the patient, but full access to the nurse need to be verbal, the availability just to walk out to go to the nurse or through some type of pass or electronic apparatus to let the adult know the child needs access to the nurse. But others are listed on the screen. Carrying a bag or a purse with supplies is very important, either be for menstruation or for nosebleeds with a bleeding kit. If there is multi-levels, we do suggest an elevator pass during muscle bleeds or crisis. Shortened walking for patients during a certain crisis is advisable, maybe even bringing the work to one room and the patient staying in one space if needed. But short-term health plans will be provided by our establishment and during those times. Extended time for testing, assignments, or completions due to bleeds or crisis is considered an accommodation that would be highly needed too. Other differentiation and modifications be done one by one due to the patient's diagnosis and need, but we are here to assist during those meetings as those are discussed. If you do feel that your patient could benefit from either a 504 or an IEP, there are statements that Innovative Hematology can share with you that look like what is on the screen, including basic information stating what you are needing and why. Understand this is one for an IEP where This statement is more directed to a 504 request. Either needs to state your patient's name, your intentions, and why it is you're trying to request what it is with your name at the bottom. This needs to be turned into staff. That is going to be your timestamp for the review for your request towards a plan to be created. Transition services don't end when your child graduates high school. College disability or post-high school disability services are also available. This would include you filling out a form on the website that is typically created by the university and then having our doctor sign off on other accommodations that would be beneficial for your college or vocational school and how this can benefit this patient. Some accommodations are on the screen, but you will eventually sit down with your university and discuss what accommodations, either from the 504 that will lead you past high school or the previous used IEP. Other transitional services provided by Innovative Hematology school and career counselors aren't just going to stop when you graduate. They'll follow you into the world of work past graduation. We offer services like our assessment surveys, linking you into careers that match your personality. We also offer educational opportunities and training services outside of the norm, like voc rehab, next level jobs, and then we can offer assistance helping locate jobs in your area, fill out applications, resumes, cover letters, and practice interviewing skills. Understanding the different types of diploma can be confusing, especially knowing that Indiana just started an alternative diploma, which is a standard-based diploma available for students that are seeking special circumstances to graduate. Need it be medical or cognitive disabilities, but this is just one of the multiple degrees that are available. There's a general diploma where you can enter into the world of work post-high school graduation. Or there are Core 40 diplomas leading you into academia world. Need it be through an honors diploma or a technical honors diploma leading you into vocational or college education. Innovative Hematology is here to assist you as you decide on your graduation pathways. Those are typically decided now, starting 2023 in high school, to help gear your classes towards classes that will lead to understanding and ease ability as you transition into those degrees of study post high school graduation. I understand there's a lot of information on the last slides, and it's a lot to take in, but that's why the career counselors and the school liaisons at Innovative Hematology are here to assist you. Please use the QR code or the numbers on the screen to get in touch with us at your earliest convenience for all your school and career needs towards IEP and 504 decisions. Thanks for your time today.